Okay, I'd like to welcome everybody back today, Alabama Care. We have the pleasure of having Mrs. Elizabeth Patton, Programs Coordinator at Disability Rights and Resources, and Nicole Watkins is a peer advocate at DRR. And today we're going to be talking about advocacy. And at this point, I'd like to hand it back over. Mrs. Patton, if you would introduce yourself.
Hi there, my name is Elizabeth Patton. I'm the program coordinator at Disability Rights and Resources. Been there for about 5 years and just really enjoy working at the agency.
Now, are you originally from Alabama?
I'm not. I'm originally from Seattle, or the Seattle area. Grew up there, and then I lived in Albuquerque, New Mexico for about 10 years before getting to Birmingham. I like to say that I wasn't born in the South, but I got here as fast as I could.
I like it. And Mrs. Watkins, if you would introduce yourself.
Sure. I'm Nicole Watkins. I'm one of the peer advocates at Disability Rights and Resources. I use she or they pronouns, and I've been with DRR for a little over a year. No, wait. Yeah, about 18 months now, I think. And I've been working in advocacy a long time, but I used to be a teacher, and I'm a transplant also, originally from Wisconsin, but you can hear it in my voice, I'm sure. My friends back home say I have a country Yankee accent, so I don't know what that is, but and I've been here since 2007.
So it's nice to be on screen with fellow transplants. I've been here for a little over 4 years, so grew up in Philadelphia and moved here in Philadelphia, and then I went to Phoenix, and now I'm in Birmingham, Alabama. So, well, if you could give us a little bit of background on what Disability Rights and Resources is.
You bet. So Disability Rights and Resources is a Center for Independent Living, which is kind of a generic term for a federally mandated nonprofit agency that assists people with their disability rights. There's at least one in every state. Our state has 4. And we're really proud of that. One in Montgomery, Mobile, the North Alabama area, Huntsville area, and then of course ours in Birmingham. And the nonprofits, we're federally funded, and we're the only agencies mandated to do nursing home transition, which is transitioning people from the nursing home and back to the community. And we are also mandated to do other core services, but yeah.
That's a big one, going from the nursing home to the community, because a lot of people that I've spoke with, they feel like once they are in a nursing home, and a lot of people in the nursing home feel like it's kind of, you may be there for a long time, you may be there for forever. But to be able to, and I've heard success stories about transitioning out of the nursing home, but I think it's a hot topic that should happen more often.
It really is.
No, you go ahead. I cut you off.
No. I was just going to say it really is a hot topic right now, especially during the pandemic, where the nursing homes were kind of some of the hot centers, and it takes a whole group to help move somebody out. And you're right, people don't realize once they're in a nursing home that they have the right to move out, and so that's kind of what we do. Yeah.
Now we're going to be talking about advocacy today, and I'd like to ask each one of you if you could say, what does advocacy mean for you?
Well, for me, I think advocacy means when you encounter a problem, right? Are you going to sit back and just accept that problem? Like, for example, that you can't get into a building or the programs aren't accessible to you. Are you going to just sit back and accept that? Or are you going to try and rally and kind of do something about it? Could even be something as simple as advocating for flexible work schedules, right? Or advocating to your parents that you want to go out on the weekends. If you have teenagers, you kind of know about that. So I think it crosses all of our lives.
I like that.
And Mrs. Watkins, is there something that sticks out for you?
Yeah, I think this is something that I've learned while working at DRR, but for me, advocacy, you can't really do it without confidence. And I think that's something that I've learned myself over the year. And this is with self-advocacy, right? Like if I need an accommodation at work, I have to have the confidence to know that that is my right? Like it's protected. I have to go into that conversation being confident in what I need and what I know. And then when it comes to systemic advocacy, I have to be confident that my community will have my back and vice versa, right? That I need to have the back of the community. And I think that that's really something I've learned over the course of advocacy work is you can't really be a people pleaser, and it's going to make some people annoyed with you. And that's part of what advocacy is, but that's what the community's for, right? You have each other and you have to fight together.
I like how you both say that, because when you say speaking up, sometimes I am nervous to speak up because I don't want to get in people's way. I don't want to cause a fuss. But then that also comes back to having the confidence in what I'm saying is going to make a difference for myself or maybe for other people around me. And that confidence comes from both experience and learning, what is possible there and your rights. I like how you guys back that up with the rights, because that's a solid backing. Like, no, this has your back all the way.
Mm-hmm.
Mm-hmm. And then if I could ask you both, why are you passionate about advocacy in disability?
Oh my gosh. So I'm passionate about it because we hear it every day at Disability Rights and Resources. So, right, our people are still being oppressed. And when I say our people, I mean the majority of our staff are people with disabilities. So we represent with disability pride. And those of us that don't have disabilities are parents of people who have disabilities or allies. Like, our whole agency is people who believe in disability rights and the idea that our people are still being oppressed, from being in nursing homes to receiving certificates of attendance instead of diplomas, and so they can't go farther in their education after they graduate. Right, so and we need to be. They don't have the voice right now, and so we need to be the voice for them and bring them along with us. So often we get calls from people who are stuck in that place where they can't pay their bills, and Nicole and I talk about this all the time, where you can't go advocate for a higher level thing if you're just worried about paying your bills. And so we hear it almost every day, these needs that are out there. And so it's our responsibility and our role, and we take it very seriously and are passionate about it, to bring that advocacy forward for those individuals.
Yeah, it's kind of like the hierarchy, the Maslow's hierarchy. If you don't have a place to rest your head and things to eat, you can't advocate for, greater education or those types of things. You have to meet those basic needs first. And Mrs. Watkins, is there anything that stands out to you about being passionate about advocacy?
Yeah, I think it comes from what Elizabeth said about most of our staff being people with disabilities. Most of our community are people with disabilities. And I came to that advocacy because I myself am disabled, but also realizing, again, it's that confidence thing, right? I can't do this if I don't have my people, right, so to speak. And I think that disability advocacy intersects with so much, especially in Alabama. It intersects with racism and gender and all sorts of medical injustices that we see. And I talk about this a lot, but 35 to 40% of people with mental illness are incarcerated, right? That stuff has to matter in the big disability advocacy bubble. We can't talk about it as an isolated project, right? That it's all related. And for me, that's what disability advocacy and disability justice means.
When you're both speaking, I feel like there are big gaps. Like maybe some other advocacy has had a lot of traction recently, in the past 30, 40 years, but there's still a lot of big gaps that disability advocacy is going through right now, and a lot of big gains that we're looking to see in the next few years. That sounds about right there.
And yeah. So it's like, I don't know how to begin tackling that. Yes, you are absolutely right. Like, I know that, like you said, there's a lot of movements having traction right now, and I think that we're working to kind of work with other groups to bring disability rights to the forefront. I know that specifically, like, housing issues right now, we hear it every day, but it's getting even worse after the pandemic. The idea that housing is not accessible, and if it is accessible, it's not affordable. The transportation issues. So yeah, you're absolutely right. There are a lot of gaps out there.
I was on a call the other day. It was go ahead, Mrs. Watkins. I'm sorry.
Oh no, you go first. Sorry, the little delay makes me.
I was on a call the other day where there was I believe it was a senator from Georgia saying that now is a really big time for a hot topic for transition to independent living and community living. When you see that it's a better option, especially during a pandemic, it's a safer option. And so now's a great time to strike at the local Congress level, the state Congress level, saying, hey, we know these are more healthy situations, both physically, emotionally. Now's the time to kind of push these things through your local legislators and representatives. And Mrs. Watkins, I apologize once again, I cut you off there.
No worries. No, that's the nature of the digital world, I think. I did it to you too. I think what I'd add too is we talk often about disability rights, and what I mentioned earlier, right? We have these protections under the law, and we have examples like you're talking about to help get folks out of congregate facilities, and we use those because they're important. But that's the law, and then what people experience, the daily injustice people experience, is difficult to legislate, right? How do we legislate this entire group of folks out of poverty, right? How do we legislate better medical treatment? How do we legislate health equity? And we can't really. So that those are the gaps for me that I think that we have to kind of stick our noses in, just because there is no real way to make a law to say, okay, well, you have to treat everybody equitably. You can say that, but in terms of how people actually behave in those settings, whether it be in nursing homes or whether it be in medical facilities or out in the community, or trying to deal with the housing authority, right? They have these regulations, and you can maybe go after them if they don't follow them, but it doesn't mean people are treated well or justly, and they don't have access to resources that they need. So that's a big gap to fill. It's not just us doing it, but I think that's why Elizabeth said we're working with all these organizations and different groups to try to fill those spaces.
Mm-hmm. And for DRR, about how many individuals would you say that you served through advocacy, maybe a year or in a certain time frame?
So that's really hard for us to like pinpoint. We're doing a better job. It's hard for any Center for Independent Living to do. So for example, we have our upcoming Independent Living Advocacy Day on April 13th. Got to give a shout out to that. It's going to be amazing. We've got Senator Doug Jones is coming. We've got Nicole can tell you more about it. She's in the lead of that. But for example, we might have in years past we've had 200 to 300 people attend that. But there's not really a count of it, right? And so, and they're not really considered consumers necessarily. So we do a lot of advocacy work. We do an Advocacy in Action Academy workshop that actually, our very first one, Alex, you came and taped at our center. And so it's just things like that. So I would estimate that we probably touch maybe 500 lives, 500 to 600 lives a year through our advocacy. Now, our one-on-one services, we help about 200 to 300 people a year with those.
Mm-hmm. That is quite a bit. I remember being there for that first time, and everybody was like, "Who is this? Like, why are we doing this?" Yeah. I'm like, "I'm just in the background, guys. Keep going, keep going." Now we're speaking for April 13th, the individual advocacy group. Let's give a further shout out to that. How would someone join, or is it open to the public?
It's open, yeah. It's open to the public, and I think if nobody has, I can maybe put the Zoom link in the live too when I'm not speaking. You can register to sign up. We want people to register because we're sending out little gift bags to folks who are going to be attending, little things to get you inspired by advocacy. So we're really excited about that this year. And because it's virtual, right, we want to do a little something nice for folks who are attending instead of being there for the big rally at the Capitol, because we want to keep everyone safe. But yeah, that's on April 13th. It's going to be from 9 to 11:30 that morning. The first part is going to be a presentation, right? We're going to talk about things in Alabama that are there right now that affect the lives of people with disabilities, specifically legislation and public health stuff. Vaccines are one, Medicaid expansion is another. And then we'll be having lawmakers on for the second half of the event. And Elizabeth mentioned Senator Jones is going to be there, Anthony Daniels in the state legislature, Representative Neil Rafferty. We've got some folks attending. And the goal for me is kind of demystifying it all. I think that legislative advocacy is confusing. It's confusing for people of all varieties, not just people with disabilities, right? And it takes seemingly, grad school to understand. And I don't think it should be like that. Those folks in Montgomery, they work for us, right? And trying to remind people with disabilities that, hey, speak up with confidence because you are the expert in what you need is really what I want to get across that day. And I hope we can. So I'm excited for it.
It feels
I really
like a
love
blur to me.
that idea that we're the experts. Sorry, Alex, go ahead.
No, I think that's perfect. Please. I feel like it is kind of a blur. Legislative advocacy. I've had a few conversations about it, but there feels like so many steps, and you have to kind of strike at the right time and the right person that's going to. So I think it's awesome that you guys are bringing these representatives into your world, into the disability community. Yeah, and it's tough right now because we can't get down there and knock on their door. Yeah. So now you said confidence. I hear the word confidence come up throughout. And is there any, for each one of you, is there a particular story where you notice confidence change in yourself? Maybe when you're growing up, or is there something that really changed? Like, no, I'm taking a stand here, and then it was different from that point on.
Wow.
I know I'm going to kind of put you on the spot there.
Yeah, that's a big question. Well, yeah, I would say for me it was when so I was a restaurant manager for many years. I had a degree in sign language interpreting, and when I moved to Alabama, I was doing restaurant management. And when I moved from that to working at the Alabama Institute for the Deaf and Blind, I know that my confidence in my skills, my confidence in working with people with disabilities really grew. And from that, I was actually able to go back to the restaurants I worked at and speak more confidently about hiring people with disabilities. When I worked there, I would bring it up, but when I was shot down, I would just kind of go, okay, well, I understand. And through the confidence that I gained working at AIDB and ADRS, I was able to go back to those old restaurants and say, no, you need to hire these people, look at all their skills, and they actually ended up hiring several people. So,
yeah, that's amazing.
And that just came through knowledge and experience. Yeah.
Mm-hmm. And Mrs. Watkins, is there anything that stands out for you?
Yeah, I think this is sort of an emotional childhood moment. But after my mom died, I was mostly raised by my uncle before he also died, and he had several complex disabilities, right? Heart disease and back injury, and he was on disability while he was my not guardian in the disability sense of the word, but my caretaker. Mm-hmm. And I went to the store with him, and he was on food stamps, and the cashier was having trouble with it. I don't remember what it was. And people in line were making fun of him, and they were saying he was taking too long. And the cashier was probably just, a teenager being flustered. I don't blame them at all. But I will never forget, we walked out of the store, and he just kind of grabbed my hand, didn't get any of his groceries. And I had seen him cry maybe 2 times in my life, and I could tell he was crying. And I remember thinking to myself, okay, this is just wrong. And I didn't know how to explain that it was wrong, but it made me realize that I wasn't going to let anybody around me get treated like that. And that evolved, obviously, into professional and personal work. But I think that connection is really what got me, whether people are going to mock me for speaking up or yell back at me. The next time this happens, I'm just going to say, hey, let him take all the time he needs in the line at the grocery store, right? It doesn't matter. And that was a good, watershed moment or whatever we want to call it.
Yeah. Those are amazing. I appreciate you both for sharing those, because I kind of put you on the spot there. And I guess in lieu, I'll say a little bit about when I became a little confident in advocacy for a family member of mine. I have a family member who has an intellectual disability and is about 57 years old and functions at about a 3-year-old level. So she needs full-time caregivers with her at all time. And I came here to Alabama to really make sure that her level of care didn't go down when my grandparents, her parents, got older, and as they kind of aged, and my grandfather, who was her guardian and would oversee the operation, passed away about 2 years ago. And I had trained under him for 2 years, and now it was a transition of, I have to become that person to speak on her behalf. She's nonverbal. And there was one time shortly after that I went over to visit her, and I noticed that she was kind of barricaded in the bed. She sometimes will get out of bed at night when she's not happy, or maybe she went to the bathroom, and the caregiver had barricaded her in bed so she couldn't get out of bed. And I just immediately put down my phone. I was like, you're out of here. This is not happening. And it was kind of that step up, like, her care matters more than you being here matter to me. So I appreciate you all for sharing that. Okay, I'd like to ask for I'm going to acknowledge chat here. AC Patodi, I hope I said that correct, has put a link in the chat, and I'm hoping that is for the April 13th Zoom, and it may be. I'm not going to click on it right now. Disability Rights and Resources. Okay, great. It says register for Independent Living Advocacy Day here. So thank you very much for putting those links in there. Leslie Speakman says, my daughter is going to Gentry for college prep. She struggles with hearing people that put their orders in. So I'm thinking she's talking about along the lines of, kind of in a work environment there. Mrs. Speakman, thank you for sharing that. I would like to ask for someone that's looking for advocacy services and looking for assistance. When they contact DRR, what does that process look like? And if we can explain that to them so it's not the unknown for them.
I would love to. So when you call our phone number, which is 205-251-2223, you're going to get Sparrow. And Sparrow's amazing. She's our receptionist. And she's the first person you're going to talk to. The second person you will probably end up talking to is Heather Sims, who's also incredible. And she's our information and referral specialist. So rarely do we get that call where people call and go, I want advocacy, or I want to learn advocacy, right? We are really holistic in the idea that I was talking a little bit about. When people call, it's often things like, I'm not getting the services I need. I need to apply for food stamps. Can I get help? And so oftentimes, once they work with Heather, they end up with a peer advocate who can really help them navigate the system and raise them from that level that we were talking about, that Maslow's hierarchy, to that place where they can join us on some of our events. Every Friday, we have the Alabama Disability Action Coalition call, which is amazing. It's Friday at 1:00. AC, if you don't mind. The AC is the lead, is the chair of that Friday call, and that's set up with some committees. So we're really more about helping them one-on-one and then inviting them to a lot of our events. Rarely, like I said, do we get a call about advocacy. But if somebody was wanting to join, we have that Friday call. That has several subcommittees. There's a public health subcommittee and a poverty and injustice subcommittee. There's the third Thursday of every month, we hold an evening event called a happy hour. It's a disability happy hour where we really, really want it to focus on people with disabilities being able to talk to each other. It's not a place where we're being talked to, right? It's a place where we're talking about big topics, the intersection of ableism and racism, what it's like to identify as a female and have a disability. This upcoming month in April, we're doing parenting with a disability. So those are some of the opportunities that they can come and advocate and learn self-advocacy. Also, I wanted to just kind of say again that we have the Advocacy in Action workshop, which we can do from 3 hours to a couple days. And that's something that anybody could call when you get Sparrow. Just ask her about it, and we can come to whatever event y'all want us to come to do that.
And as you go through that process, Mrs. Watkins, I'd like you to talk a little bit about when someone gets paired with a peer advocate and what that looks like.
Yeah, sure. I think it's different every time, I think, to start with. And Elizabeth is exactly right in that I don't think I've ever had anyone come to me and say, I want to advocate for myself. Can you help? Right. People just don't. And that's not how I talk either. Right. I mean, like, it's just people will come and they'll say, I'm really having trouble navigating the system. I can't find what I need. They don't believe me at DHR. They don't understand that I don't have access to XYZ. The biggest gap, I think, is probably mental health services, right? So when people say, I see people a lot who get caught in between, okay, well, you need a doctor's note or doctor's documentation to say you have a disability, but you can't afford to go to the doctor because you're not on disability. And it's so circular that people get anxious and frustrated and exhausted trying to navigate the system. And for what it's worth, too, it's a huge part of my job, and it's exhausting to me, right? I mean, like I learning these different steps and trying to navigate that is difficult. So a lot of the time I'll talk people through that. And sometimes that looks like peer support, right? Sometimes people will call and say, I am really struggling this week. I don't know what to do. And we'll talk about what other people have done in similar situations. I'll talk about myself and what I've tried. I don't tell anybody what to do, right? I'll kind of explain, here are some ideas. Maybe we can make a plan. And that often helps people become less anxious, right? To just have steps written out. And again, nobody really comes and says, I want to do a step-by-step plan in order to get food stamps, right? People just, nobody thinks that way. But that is the kind of the end result of what'll happen, right? Like we'll figure out, okay, first we need this kind of document. Let's get that together. Let's figure out who to call. Let's get that in the mail. And sometimes people want to take the next step, like Elizabeth said, right? They'll want to join the Friday calls. They'll want to talk about advocacy in sort of a systemic way, but that I've never seen that happen without some semblance of stability first. I think that would be true for all of us. It's the Maslow's hierarchy again, right? The biggest thing is just everything stems from poverty, always. Whether on disability or not, it doesn't matter. And I think we all know that disability is not enough to live on, right? So yeah, it's that I think is the most difficult aspect of peer advocacy. Is if I had a magic wand, I would make all the housing and all the money appear. It's just that is the biggest need. And sometimes I have to say, I sometimes we just have to say there's not enough money there. What else can we try? And we don't give up on people, but it's frustrating to see those systemic issues continue to exist. So that's what the other part of the advocacy is for.
And I know I've heard there are places around the U.S. that are starting to implement or trial some universal basic income, other things like that. And I see that, you may not qualify, but we need to start working on these things now. And intellectual disability, where someone's not quite on the waiting list or hasn't received a waiver service, what can we do at the home and with our local support group, friends, family, to kind of supplement that till we do get on that waiting list and receive that service? And as you go through this, I imagine that maybe some of the first conversation is really allowing someone to speak and be heard if they're feeling like they're hitting a brick wall and no one's listening to them. So it sounds like the first part of the conversation is tell me how everything's going, and allowing that person to really be heard for the first time in a long time.
Absolutely. We hear that a lot, actually, where people are like, oh my gosh, not only did you pick up the phone or call me back, but you're actually listening. And so, yeah, those first phone calls are often just letting the person tell their story and get it all out.
And then when you move to the next step of kind of, hey, this is where you want to go, that game plan really, for me, if I'm feeling anxious and I have something coming up in the day or next month, if I just start to break it down into like, okay, this is the steps to get there, it relieves a lot of uncertainty and anxiety for me that if I don't do, we'll build up and build up and build up. And then I got to go play hockey or do something to let it all go. So we have a few different things here in the chat I'd like to acknowledge. April Buchanan Turner says, would you mind sharing your website info? And below that, it looks like Disability Rights and Resources is doing a great job in linking those. So I appreciate your agency for being on top of that. It makes it very easy for us to not have to go back and put those links in after the broadcast. Okay, so we went through what does the process look like. What would you say are some examples or I won't say tricks, but skills of learning how to advocate for yourself that someone watching could be like, okay, I'm going to start implementing this today?
So I'm going to jump in, I think, and say, I think for me, the first step, and certainly this is when I started learning to advocate for myself or thinking of it in those terms, that the first thing I think of is, what is my goal? Right. And again, that's really hard to do if you're in a situation where your anxiety is really high, but kind of looking at what is your goal so that you don't get kind of pulled off track. Right. Or you go in knowing what you want to say. And then the second part for me would be kind of determining who is the person who could make that decision. And then kind of laying out your thoughts about it. I know I'm going to just say it again. The Advocacy and Action Workshop does a really good job of, we use improv, the idea of like, whose line is it anyway type of improv to teach those skills. The idea that you don't want to shut down whatever. So if you say something to somebody and they come back with, that's not going to work. Are you going to shut the scene down, in other words, and just be like, well, okay. Or are you going to come back with, well, no, here's this. So I think having your kind of a layout of what you want to say and what your points are is a good way to go into it.
I like how you addressed maybe not focusing on the gatekeeper, but the decision maker there, knowing your audience and who is able to make that decision. It sounds we are funded through the Alabama Council of Developmental Disabilities. And I remember when I first wrote the grant, I looked up who the council was and each person that I could find information on to see who would be reviewing the application process. Mrs. Watkins, is there anything that sticks out to you about skills that somebody could take away and start building on their advocacy today?
This is actually kind of why I'm glad I had a chance to have an organizer background before the work that I do now, because what you're talking about is what I'd call power mapping, right? Like trying to figure out who makes the decisions, and also, and again, that word, right? Confidence is when you go in there, and if you do get stuck, from someone who's trying to prevent you from seeing your lawmaker or seeing your city council person, because that's maybe their job, right? Is to kind of, diffuse the influx of folks. You can just say, I'm not going away until we address this, right? Like I'm not leaving. And you can be assertive and you can be, kind of hold your ground without being a jerk, right? Wait, but I think that sometimes people, confuse the two. And as one of the things that I keep coming back to is, understandably so, we are kind of a culture of hospitality and politeness, and advocacy is just not always like that, right? And it can be scary and unnerving, and it still is for me, to be able to stand my ground even when I know that maybe the whole room doesn't like what I have to say. But there's an Audre Lorde quote I really like that is, speak up even if your voice shakes. And that to me is key always. And I think talking to people who are new to advocacy, reminding them that they're the expert in what they deal with every day, reminding them that no matter what anybody says to you to try to make you feel like you don't know what you're talking about, you do know what you're talking about, and you deserve to be here. And I think people with disabilities have heard so much throughout their lives, whether, implicitly or explicitly, that they're burdens. And we aren't, right? And that takes some, self-convincing first. So that's kind of where I'm at with it.
I love that quote. Speak up even if your voice is shaky. I took a few classes of science, physics classes in school, and it reminds me of the kinetic versus standing still, the static versus kinetic friction, where as long as you start to go, it's easier, and maybe your voice will start to get more powerful, even if it starts off shaky there.
I love that. That's really well said.
What is the most challenging part of advocacy?
I think the most challenging part is picking, because you only have so many hours in a day, right? It's really picking, how are you going to focus on? What are you going to focus on? We, like I was talking about, what we see day to day and the calls we get and the people we work with, that kind of informs as an agency what our systemic advocacy issues are going to be within our agency. But there are just so many. And then do you take those big topics like public health and break it down into vaccines, doctor visits, insurance? How do you really organize yourself when there are so many big topics? And how do you do it? For us specifically, we're a cross-disability organization, and meaning we'll work with anybody with a disability and any age, and so that again just even broadens it even more, right? So we're not just focused on issues that are oppressing people with blindness, but we're working with people with all disabilities, and so I think trying to really focus in and narrow where you're going to focus your energies.
Mrs. Watkins, is there anything that pops up for you as being the biggest challenge in advocacy?
It's another quote. This is what you get for having a former teacher on staff. But Dr. Angela Davis talks about being a radical. And she said, a radical just means grasping things at the root. And that's the challenge for me. It's like Elizabeth said, we have all these things that intersect. So if you've got public health, and you see discrimination in vaccine distribution, you see a medical model of disability that kind of informs people that they are broken, right? Rather than a social model that promotes community living and engagement. And all of these things intersect with different systems. And I think trying to get to the root of the problem, which is, essentially oppression at a variety of different levels, but that's the hardest part, right? It's like, okay, so we have this problem with vaccine distribution. So Okay, we'll talk to the public health department. Well, the public health department gets its guidance from the Center for Disease Control, which is in Atlanta, which gets its guidance from, and so on. And we have to think about the ways in which people with disabilities have not been involved in that planning process. But it's all the way down, right? It's not just local Jefferson County Health Department. It's all the way to the top, all the way to the bottom. In terms of lawmakers who serve in Congress too, right? I mean, like, look at Tammy Duckworth. It was a big moment when we had this woman with disabilities in Congress. And when you have that lack of representation that drops all the way to the bottom, I think that's the biggest challenge, because it's not, I think that Elizabeth and I have talked about this before, not just asking for a seat at the table anymore. We're going to flip the table over at this point if that's what it takes, right? We need to, we have the right to, and we need to have that involvement, not just a sort of, placating seat, right? Like, okay, you can come in the room, but we're still going to ignore you. We want to make the plans and make the policy. So that's a long answer to your question, but I'm very passionate about it.
Well, I'm right there with you guys, and I appreciate you sharing. And it seems like as you go through that, you might have a certain number of people call saying this is something they're coming into contact with that is a challenge in the daily life. And I can see how it would be tough to say, okay, we're going to focus on kind of a very higher level solution so that it helps everybody in the future versus, do we focus on this one individual that just called in and we might be able to help them this month. But you would be doing that for a long time until you get the bigger solution fixed. So it's a give and a take there. I'm going to plug in my computer very quick. Losing battery here.
Understandable.
I appreciate that you said that, though, because it is really true. That is kind of the dual sides of what we do, is that one-on-one work where we're advocating and helping somebody learn their own self-advocacy on that level, and then the duality of it, of taking it higher to that systemic level. So I'm glad you pointed that out. Thank you for that.
Yeah, it's kind of like you go back and forth there, and you wish you could do both, but there's so many hours in the day and so many resources there. If you could explain the three different types of advocacy, so someone watching would know the difference of those from self to group to systems.
Nicole, I'm gonna throw that one to you, I guess.
Oh, okay. So for me, I was just saying,
sorry.
No, you're good. For me, self-advocacy, Elizabeth has talked about the Advocacy in Action workshop, and that is the best example to me. It's, okay, I have this issue. Right. And this issue that I find is, I'll give you an example from one of our workshops, people needing more stable and better constructed sidewalks in their neighborhood for wheelchairs and better curb cuts, right? Which is a relatively non-controversial advocacy issue, right? Like, we'll take that. This is the basics of our rights. And this person says, okay, I have a problem with this. And they go to maybe their apartment manager, or they go to their city council person and they talk about it. And maybe the city council person does something, maybe they don't. Group advocacy would be all of those folks at the Advocacy in Action Academy being like, hey, I have that problem too, and they don't have proper curb cuts in my neighborhood. Let's all go to the city council person. Let's all complain about the fact that this doesn't exist. Let's present a solution. Let's write a letter. And more likely that city council person listens, because there are 20 people, they're either there in his office or they're virtually or whatever it may be, and saying, hey, this really is an issue. Because then it's not just one person filing a complaint. It's a very obvious problem. And systemic advocacy, I think, is the next step even beyond that, if we're thinking about public access in sort of a visible way, right? Like the curb cuts, all of that stuff. Systemic advocacy is the ADA, right? That's what it was. It was this huge landmark piece of legislation that was passed so we wouldn't have to theoretically be having to do those little itty bitty pieces of advocacy to have better and more equitable neighborhoods and sidewalks and wheelchair accessibility. In practice, of course, we still see all that stuff. But I think that's the idea, right? Like, we have a local problem that maybe is unique to one person, or they think it is, until they talk to their neighbors, and then it's a group problem. But what can we do at a whole other, maybe state, maybe federal level, to make this problem go away, right? So, I mean, that for me is kind of the three tiers.
I feel like as you go through that, as you meet other people that have the same challenges, you kind of combine voices and your voice gets louder. As the state and the federal level come in, you'll need a louder voice.
For sure.
I would like to ask an example of a success story in advocacy that you've been a part of or that DRR has been a part of that really sticks out to you for each of you. I'm putting you on the spot. I know.
I know. Yeah, it's like.
I know who I'm thinking of. It's a specific person, but if you have an example, I'll let you speak first.
No, you please, Nicole, then I'll go.
Okay. There's a person that we serve that I met right after I first started, and if he's watching, he'll know I'm talking about him and hopefully be excited. But we went through a lot of different things together in terms of the advocacy I was talking about earlier, right? A lot of the systemic barriers and the issues I was mentioning. And I think that one of the best things about my job is you really do develop relationships and friendships with people, in that I'm someone's advocate, but it's also my community, right? I have a disability too. We advocate for something together. This stuff impacts me just as much, right? And that's the goal. That's the multiple voices together. And we went through some of these basic needs and we talked through them. And some days it was peer support and some days it was tackling a systemic barrier. And then gradually we kind of got to a stage where, I guess, to put it simply, moving up the Maslow's hierarchy, right? So he wanted to do more systems level advocacy from the perspective of a person who had been through it, right? Which is really meaningful to me every day, because we can talk and talk and talk and say, this is what it's like for someone in poverty. This is what it's like being on disability. But our lawmakers and our decision makers are so far removed from what that actually feels like. So to have someone there saying, you don't understand how difficult it is to get anything done if we don't have rural transportation. I can't even go grocery shopping. They can't fathom that without someone explaining that. So that's kind of my success story. It's just an example of one person realizing it isn't just me and feeling comfort in knowing that they have community, but also kind of collective outrage at the lack of access that exists. And that's very therapeutic, I think, for people.
Therapeutic. I like that word.
I like that you mentioned creating the safe space, because I think for me, that's our biggest current success story is the Alabama Disability Action Coalition, which began as a place for people with disabilities and other disability agencies to come together at the beginning of the pandemic and talk about unmet needs, right? So again, we're going back to that individual, like, what are you guys hearing from your consumers that they need? And from that, it really built over the 6 months, and Nicole took charge of it and was the chair, and is the chair of the Public Health Committee, and grew it into this Disability Action Coalition, where in the last couple of weeks, we've really been focusing on, and Nicole, you feel free to take over if you'd like to, but because you've been leading it, but we've really been focusing on the vaccine distribution and some of the issues around that, where there are people who aren't able to get the vaccines, and maybe they don't even know that they have the right to say, hey, this is my right that you help me to ADPH, help me get the vaccine. And so we brought together with the Disability Action Coalition individuals who have disabilities, other agencies that focus on people with disabilities, and we've really brought it kind of, I think, to some people's attention, and I hope to see some really good outcomes from that.
I love how you both went through that, and it seems very like DRR, Disability Rights and Resources, is innovative and also adaptive to when people are coming saying, hey, I'm experiencing these types of challenges, like with the pandemic. That's something new that I've never experienced. But to be able to kind of shift gears there and say, okay, this is something that we're seeing right now that has a big impact. Let's focus on this, and to be adaptable there and bring the community together, I think is. And I said this to Mr. Kessler as well. I think puts you guys pretty high up on the ladder there for organizations that are continuing to be in the spotlight. I would like to just highlight chat here. Disability Rights and Resources says the ADAC meetings aren't recorded at this time. The link is below if you'd like to join us. We'd love to have you. Feel free to contact. So anybody that would like to get in there, please send an email to ac.podcast Poteete. How do you say that last name?
AC Poteet.
Poteet.
Poteet. Mm-hmm.
Poteet. At drradvocates.org. Mr. Dan Kessler says DD Council has supported disability rights and resources.
It's very true.
Leslie
I'm sorry. I did want to give a shout out to ACDD. They were instrumental in helping us with the grant money to start the Advocacy in Action workshop. So very grateful to them to give us the money and the time and the support to be able to put that together and roll with it.
Yeah, they've been awesome. And there was a little bit of changeover with ACDD there. There were a couple of people that retired, and everybody new has been coming in with just a bunch of energy, and I'm super excited about the entire organization.
I am too. I love working with Daryl and Felicia. They're great.
Mm-hmm.
Can I take a Oh, I'm sorry. I was just going to say I wanted to shout out AC for one more thing that is related to advocacy successes, and it's the healthcare story program that we're working on. AC is spending a lot of time and energy producing this beautiful thing that is going to be a series of stories about people with disabilities and the barriers they face in healthcare. And the goal here is really recognizing that we need equitable and universal healthcare. And there's a pinned post on our Facebook page too, and AC will probably link it in chat too, but this Friday there is a Zoom call at 10 a.m. If you're interested in participating in that. And that's open, that's open to the public. I'm really excited about that project. Healthcare is my entire passion, personal passion project. So I had to mention it.
Very cool. So how can we expect to see those stories being shared?
When we are finished, Elizabeth, maybe you should speak about this because I know you and AC have talked more about it than I have.
Yeah, so we're kind of excited about it. It came from one of our happy hours that we were talking about, where we do kind of the evening happy hour, and it kind of came from a conversation there where the idea was that they're not listening, lawmakers are not necessarily listening to us one-on-one. So we want to combine all the voices in a can you hear us now? If we're all shouting together, can you hear us now kind of idea. And so it'll be on our Facebook, it'll be on our website. But what we really want to do with it is we want to do kind of like an ice bucket challenge type of situation where we then call on other agencies in Alabama, other centers for independent living in other states, and say, here's our stories, you tell us yours. And we're hoping that it'll create like a ripple effect across the country of disability organizations coming together to share their stories. Yeah,
that'd be very cool.
Yeah.
I dig it. Let us know if we can do anything there.
Okay.
We'll definitely shout it out. But if there's anything with content we can provide there, we would love to do so.
Oh, that'd be great.
Leslie Speakman says she's at work most days on Friday. She's responding to AC, I believe. Dan Kessler says Tammy Duckworth is amazing. And this is the first time I've heard of Tammy Duckworth. But I'm going to have to reach out and see if she would like to be on a broadcast. We can talk about some of that legislative stuff from Montgomery. Disability Rights and Resources says, understandable. If you want to give us your email, we'll figure it out. Okay, some back and forth there. If you have a story to share about how lack of adequate health care has impacted you or loved one, please join this Friday at 10 a.m. Okay, two success stories. Mr. Dan Kessler says DRR has also been supporting Medicaid expansion in Alabama as part of the Cover Alabama Coalition. If you guys would like to talk about that a little bit.
Go ahead, Nicole.
Yeah. Okay. That's actually something we've been talking about in the Public Health Committee too. We identified a few different priorities. Medicaid expansion being one of them. Vaccines I've already talked about because COVID is still, of course, with us. But one of the things that we really support in terms of Medicaid expansion, we've seen legislation this year that has provided employers in Alabama with immunity from prosecution over COVID exposures and COVID infections. And one of the things that we talk about is, well, if you're going to do that, then we need to provide health care at least for these employees. And there are so many people that fall into this gap where they can't get Medicaid because our Medicaid requirements are so stringent in Alabama. It's one of the strictest requirements in the country. And they also can't afford to buy health insurance on the marketplace. And I was one of those people. Once upon a time, I spent 1/3 of my yearly income on health insurance because I didn't have a choice. So the issue is really personal to me, but it's also, I think, deeply personal to a lot of people with disabilities who often go unidentified because some people make the assumption that everyone who has a disability is on disability, right? Or that it's easy to get on disability, and it is not. And everyone is not, right? So I think that's one of the reasons why this issue is so important. And also, I mean, everyone should have health care, right? Like, we want a healthy society for a lot of different reasons, but especially as a disability agency, we believe in equitable access and inclusion, and we don't have it. So we're trying to get it.
And what does that look like? How far down the line do you think that'll be implemented if everything goes well?
That's a good question. This year, this is a really good opportunity for Alabama. There was a brief period in which Alabama could have expanded Medicaid at no cost to the state. The issue has since been, since that time has passed, the issue has since been, where are we going to find the money for it? Where are we going to find the money? And that comes out of the governor's office and lawmakers as well. This year, with the American Rescue Act, they've offered an unprecedented, shall we say, discount in terms of what the federal match rate will be, and also the amount of money that would come into Alabama would be even greater than it would have before if we were to expand Medicaid. So I think it's a strong pull. It's a strike while the iron's hot kind of situation. If there ever were a time, it's right now. And I think we've seen more lawmakers be willing to consider it than they would have in years past. It's less politicized and more, okay, we've got this pandemic, we've got a lot of people in the gap. Rural hospitals in Alabama are closing. What are we going to do about healthcare in this state if we don't expand Medicaid? And nobody has come up with a good answer. So it's a good time, hopefully. Keep your fingers crossed.
It always made sense to me if the Congress and your representatives, well, where's the money? Where's the money? With the FMAP, the federal reimbursement rate that the federal government gives for this community is, and I don't know necessarily how it compares to other communities, but it seems like it's a very good reimbursement rate, for Alabama. And I think, and I don't know the studies on this, but the money that is spent in this community stays in state. It's not like it normally goes out of state, but it stays here and is spent in Alabama. So when they say, like, where's the money? Where's the money? It's like, you guys are getting a great reimbursement rate. By doing this, you're investing in Alabama infrastructure, that the money is going to stay here and benefit the state long term. It's such a no-brainer thing. But it's sometimes hard to get that across to them, and they've got 50 other people telling them that. But the FMAP is very beneficial for the state of Alabama, and I think we should take advantage of it.
Definitely.
And I pulled this off of the website. We spoke a little bit about it earlier, but if you could kind of explain this sentence: advocacy must take place in a particular context and be aimed at a particular target to be the most successful.
I absolutely agree with that. So I think when we're talking about the particular context and the particular aimed at a particular person, I kind of want to talk a little bit about the lanes and how they're all headed towards the same target, right? So we talk a lot in our agency about how we are all advocates. Every single one of our staff members. It's not just Nicole and I shout out to all of our staff members. And something that was said at the Nickel conference 2 years ago that really struck with me is, so when it comes to advocacy, there's many different paths, and not all of us are the kind of people who are going to go chain ourselves to buses, right? Or protest or that kind of advocacy. Some of us are people who are going to write grants so that we can have money to fund the rest of us who can do advocacy, right? Some of us are going to be the people who watch the children so that their parents can go and chain themselves to buses. You know, there are different paths, and I think the idea that if you can get all of us together in one context area. So we're not all have our own context, so we can put it all in one package and we all aim our lanes at one target. I think that is, to me, the most effective way to do it. Another way to think about it is like a pitchfork. So you've got your legislative and your grassroots advocacy and your social media and your, again, if we're aiming it all at the same thing, I think that's the most effective.
Yeah, kind of like lasers. If you combine the lasers, the magnitude of their power goes up. It's like if you have a horse with a cart, they can pull like 1,000 pounds, but if you have two horses, they can pull 4,000 or something like that.
Exactly.
We're going to kind of get to the end here of our broadcast, so I'd like to acknowledge chat once again. And if anybody has any questions for Mrs. Patton and Mrs. Watkins, please go ahead and put it in chat here. And I'll just go through here. Leslie Speakman says, I cannot afford health insurance and I cannot get on Medicaid because I make too much. I have epilepsy and cannot see a doctor. If they can make it to where we can pay around $100 or $200 a month, I can do it, but not near $300 or $400 a month. So she's speaking upon the Medicaid expansion, I believe, there. Mr. Kessler says the Alabama tax money stays in the state. And Leslie Speakman once again says, I used to be able to pay for Obamacare, and I was able to do that because it was really cheap. So Mrs. Speakman, it sounds like Disability Rights and Resources really pushing for that to happen here, hopefully, pretty soon, relatively.
Mm-hmm.
I would like to ask, are there any, we have a bunch of upcoming events. Are there any volunteering opportunities that you guys would like to give a shout out to? Where someone watching would like to, maybe it's kind of a soft join and a soft, like getting out and about or being involved. That would be a nice open for somebody to start volunteering or be a part of.
So I just want to say to everybody, so a lot of our virtual events, we have really expanded since the pandemic. And so some of the things that were posted in the Facebook Live chat, anyone is welcome to join those. You do not have to say anything. We do not call people out. Like I know one of my disabilities is anxiety. And so I don't want to join a group not necessarily knowing, am I going to get called out? Am I going to have to say something kind of thing? And it will stop me from joining. So let me be very clear. When we list these, the happy hours, the Disability Action Coalition, AC is starting an amazing peer support group that we're going to have coming up here soon, starting next month. Chris Adams, our employment specialist, is going to be doing a job peer support group. Please feel free to join those and don't feel like you can call in, you can use Zoom, however, and don't feel like you have to say anything. No one's going to call you out. That is a good soft way to get your feet wet, I think, is just to come and hear what's going on. And of course, Independent Living Advocacy Day is a great one to come to too.
I deal a lot with that myself, where it's like if I know I'm going to be called on in 3 people, I'll start thinking about my answer and I'll forget everything else that's going on. And then by the time it gets to me, I'm like, so I struggle with that a lot in classes.
Yeah.
Okay, I'm going to acknowledge Leslie Speakman. She says, I would love for that to happen. My friend, which sells insurance, can get the government insurance, but I can't because I'm over the limit. So it seems like there's quite a bit of that feeling there in the community where it's kind of like that loop where you said it's like you have to get here to get this, but in order to get this, you have to get this, you have to be on this. So we're kind of expanding one part of that to make it easier to close that loop. And as we end here, is there anything that we haven't talked about on advocacy for someone watching that as an individual or maybe a family member would benefit from hearing about?
I think for me, and then I'll kick it to you, Nicole, I think for me, when you're helping somebody advocate or when you want to advocate, I think is to create a safe space. Because like we talked about, that confidence is so important. And so oftentimes when we're listening to somebody, it may not be the same experience that you're experiencing, or, you don't have the same disability, your background isn't the same. And so I think just creating that safe space for somebody to share their story is the first step. And then I think for people who want to learn advocacy, finding a safe space where they can share their story and finding a group of people that have that atmosphere. And I would like to say that we do. I'll just throw that out there at DRR. That's kind of what we strive to do. So I think find your people, and if somebody's coming to you, make them feel safe.
Very well said. Mrs. Watkins, is there anything that you'd like to say?
It's really jumping off of what Elizabeth said, that I think our big themes, I mean, not just for Independent Living Advocacy Day, but all the time. It's like she said, all of these things are open to the public. They are meant to be accessible. And if they are not, we want to hear about it, right? It's not, this isn't, you don't have to be a policy expert to come on the Alabama Disability Action Coalition calls. We are all learning together, and we are all at different stages of that learning. And that's the idea. It takes all of us. And I think it's really important that we always meet people where they are. Not everyone has the same background. Not everyone has studied policy. Not everyone, some people are going to be policy experts, right? It just depends. But we have to make sure that everything is equitable. The last thing I would say is I have a very dear friend who was quoting, quote again, quoting someone else, but we often say nothing about us without us in the disability community, and her phrase now is nothing without us, right? That's kind of our mantra every day is that everything is about all of us, right? We can't just say we only care about this specific set of issues. So that's it.
Very well said, both. I want to say thank you on behalf of the Alabama Care community for being on with us today and spreading awareness on what you guys are doing and letting us know the types of things that you guys are tackling. I've learned a lot of stuff today, and I hope to get on one of these virtual meetings that DRR is holding here in the future and just learn more about what's going on. So, well, at this point, we're going to go ahead and end our broadcast. And if everyone would just like to give a wave and say goodbye to everybody.
Bye. Thanks, everybody.
Bye. It was wonderful.
All right.